there are a number of things that we know about medically assisted recovery and treatment and recovery, and one of them is that medications, things like methadone, like buprenorphine, they can be very helpful for people who need that in order to kind of stabilize those receptor systems and those brain systems that have really been affected by years of drug use in such a way that they really, if not, are going to take many years to kind of go back to normal and to their normal functioning. Sometimes it may take forever. Now, we don't really know yet how to best predict who's going to need long-term medication maintenance versus a shorter period of time, but we do know that based on some very good studies that anywhere between 50 and 80% of individuals who have opiate dependence will relapse within 6 to 12 months of coming off of methadone in particular. But there's growing evidence that there's a similar phenomenon with buprenorphine. But we also know that it really is the combination of medications plus counseling and plus the psychosocial services, plus all the recovery support services, that actually those combinations have the best outcomes. And so it's not enough just to give people kind of a medication and let them go on their way. We really need to actually help people achieve that recovery with then the benefit of the medications. And to me, as a general internist, it's very similar to a lot of other chronic disease management models for diabetes, for heart failure in particular, where we know that there are medications that people need to have in order to kind of deal with the physiological changes that have happened in their body as a result or a cause of their disease. But then there are lots of behavioral interventions that people need to incorporate into their lives in order to best help manage their own disease.